The vaccine that's been approved by Health Canada for children against COVID-19 is safe. It went through clinical trials before they even submitted an application to Health Canada. When we say it's been quick, I think we're often comparing to other vaccines and other medications that seem to have taken a longer time to develop. It was an emergency, and there was a tremendous amount of money, scientists' time, prioritization that went into developing this vaccine. They went to the top of the line because it is a pandemic. The review body still did all of the same steps in its review. They looked at all of the data again, all of the data that was available to make their decision. So there were no steps that were skipped in the actual review process. It just, in comparison, feels pretty quick compared to most other vaccines and medications that we know of.
A lot of the messaging so far has been, children are safe from COVID, children don't get sick from COVID. But if you look at the actual numbers, I think there's, more and more evidence that it is important to get children immunized. So firstly, any death of a child is, a tragedy and should not be occurring. And in Canada so far, COVID is on track to be the 5th leading cause of death in children in that age 5 to 11 age group. So although these deaths are rare, to me, a preventable death in a child, is something worth preventing. So I think that's the main reason. Going along with that, there is also the risk of hospitalization. So we hear a lot of the time, 99% of the time these children are not hospitalized. But what that equates to in real numbers in Canada so far is 1 in 176 children who gets COVID-19 ends up in the hospital. So for me as a physician and as a young mother, I think that statistic speaks volumes. The other things that we don't talk enough about, I think, is after infection with COVID, children, particularly in this 5 to 11 age group, are at risk of multi-system inflammatory syndrome, which, although rare, can be very serious. Children who do contract that syndrome, 99% of them are put in the hospital. So again, a very serious thing. And then the last thing is long COVID, which is symptoms that persist even beyond the acute phase of the illness. Statistics on that in children really vary, but there definitely is a risk there. So it's not just a regular cold where your child is sick, for 7 to 10 days. It can last months or, maybe indefinitely as far as we've seen so far.
Well, I think for our family, the decision to vaccinate was pretty complicated, but largely driven by a real desire for her to have some more normalcy. Certainly we realize COVID can be serious. It's everywhere with new variants emerging all the time. No matter how restricted you are in your social interactions, the kids slip up, you meet someone outside and the masks come down, and at school there's interactions at recess. So, we can't as parents control all of those contacts. So again, our sense was she's going to come in contact with this. And, I had to weigh those concerns against the concerns of the emergence of a new variant that might be much more serious for this age group. So for me, what drove that, there was a risk of doing nothing, and that doing nothing seemed to be riskier at this point than actually taking the risk of getting vaccinated.